Muscle loss with age, also known as sarcopenia, is an incredibly common but devastating problem that affects people over 50. Luckily, there's a test that can tell us if you might be at risk. Today we're going to go through what that test is and what to do about it if it comes up positive. If you don't know who I am, my name is Harlow and I'm the Over-Fifties specialist physio here at HT Physio in Farnham. And today we're going to be showing you a test for muscle loss and what to do if it's positive. Now, the test we're going to talk about today is a simple test that you can do at home. The reason I like it is because it's been validated by scientific research as a test for muscle loss with age, and it's also a good predictor of people who are at risk of falling. It's called the chair stand test. It only takes 30 seconds to do, and I'm going to walk you through how to do it at home right now. Before I show you the test, I just want to let you know that this is not suitable for everyone. Get checked out by your doctor before you give it a go and avoid the test if it causes you any pain. Let's have a look at the test now and I'll show you what to do if the outcome isn't great. So here is my favorite test for loss of muscle for people over the age of 60. It's called the chair stand test and it's been validated by the United States government. The Center of Disease Control uses this as their standard measure of muscle loss and risk of falls. It's very easy to do. You can do it at home. All you need is a stopwatch and a chair and 30 seconds of your time. The test is super simple. All you're going to do is sit on a nice dining room size chair so your knees are about 90 degrees like this. It's a nice firm surface. You're going to take your stopwatch. You're going to get it ready to time. You're going to press time and then you're going to use your legs to do a sit to stand movement as many times as you can without using your hands in 30 seconds. So you're just going to keep moving for 30 seconds. Nice technique, not using our arms, not using the arms of the chair, trying to use the knees and the hips just to take you through that motion for 30 seconds. You're going to keep going, doing as many of these as you can. And when the timer hits 30 seconds, you're going to stop and you're going to take the number of sit to stands that you did. Now we're going to have a look at the benchmarks. They're dependent on age. So I'm going to show you what normal is, what below average is, and what you need to do if you came below the average. So here are the benchmark results and where you should be above depending on your age and gender. Now the number here is the number of sit to stands you managed in 30 seconds. And your job is to find your age on this. We've got an age bracket of about 5 years and your gender, and then find the corresponding line. So for example, if you are a 62-year-old man, you should be getting a minimum of 14 sit to stands in that 30-second period. If you're a 62-year-old woman, you should be getting a minimum of 12 in 30 seconds. Again, if you're an 84-year-old man, you should be looking at this one here and you should be getting 10 sit to stands in 30 seconds. If you're an 84-year-old woman, that number is 9. You can see it just here. So I'm going to leave this here for a moment while you find yourself on this. And remember that this number is what the CDC reckons the minimum you should be getting is. So if you got below the minimum on here, what that means is unfortunately you are at risk of sarcopenia, and the research shows that people who come below the average for their age bracket are at a higher risk of falls. However, if that's you, don't worry, because I'm going to show you how to fix the problem. We're going to work on a sit to stand type exercise, gradually making it harder over time, and it's going to make sure you get better results next time you try the test. So if you came below your age bracket benchmark, the first thing we're going to do is start you off on a sit to stand program. And this is a program that's designed to help you improve the strength in your legs, and it will also help you with bone density. It will also help you with balance. And it's just one of the best things you can do if you're below the average of where you should be. It's very, very simple and very similar to the test. But what we're going to do is every single time you get up and down from a chair or the toilet or from the side of your bed, you're going to do 3 sit to stands without using your hands. So a sit to stand looks like this. We're not going to use our hands. They're going to go across the chest here, and you're going to take your nose over your toes, bending forward like this, And as you get to this point, you're going to push through your feet and lift yourself up. And then the catch is that on the way back down, we're going to go as slowly as possible. So we're going to take about 4 seconds to reach the chair, keeping the back nice and straight, and you want to land like a feather. And then you're going to go again, so nose over toes and push up. And then on the way back down, you stick your bottom out, bend your knees, slowly, slowly on the way down, 4 seconds down, land like a feather. And then one final one, nose over toes, stand and push, and then slowly back down like this. So we don't even have to add in a full exercise program to make your legs stronger. All we need to do is build it into your daily routine, and there's actually research to show that people who build exercises into their daily routine do better sometimes than people who actually spend an hour a day exercising, just because little and often with this kind of thing tends to work best. Now, if that's very easy for you, but you still didn't get a very good result on the test, I would recommend adding in some weight to your sit to stand movements. So I've got a small weight over here. This weight is about 4 kilograms or 8 pounds if you're in US metrics, and you're going to hold it like this right up close to your chest here. So you've got 2 hands up holding it close, and then nothing changes. So we come right to the edge of the chair, shuffle right to the edge just so you're on your sitting bones on the edge of the chair. The feet are flat on the floor. Your nose comes over your toes, but you keep a nice straight back. You're going to push up, and then on the way back down again, we go nice and slowly, holding onto that weight. Now, if you came very low in the average, but you still want to work on your sit to stand, the first thing I'd recommend you do is you elevate the height of your chair. And the way you can do that is with some firm pillows or a stack of towels underneath. Even if you just raise your seat up by about 2 inches, that will make a big difference to how easy the exercise is. So if the weight is too much for you, and even doing it like that without the weight is also too much, find a higher seat to use. A way to do that, for example, would be to use a pillow like this. Hopefully yours doesn't have as much air in it as mine, but if you start up like this and you're slowly going back down, it allows me to come to a sitting position very quickly, and it's also spared my knees if I have knee problems. So again, we shuffle to the edge, nothing changes, the feet stay flat, hands out the way, lean forward and come up, and then very slowly back down. Now, it's the last couple of inches that are the hardest, so I'm saving myself the hardest part of the movement if I'm finding that very difficult. Now, if that becomes easy and you progress, obviously what you do then is you take the pillow away, and then you just progress yourself through the program as it gets easier. So keep practicing throughout the day. You can obviously throw in extra sit to stands in the day if you want to get there quicker, but just doing it every time you get up and down from the dinner table or every time you get on and off the toilet, that's going to make a big difference. And I reckon most people can improve their chair stand results in about 4 to 6 weeks, so it doesn't take that long. Practice every day and you'll get there very quickly. So that's the chair stand test, which will help you test for muscle loss with age. I hope you passed the test, but if you didn't, don't worry, because the sit to stand program I shared will help you to get a better score in as little as a few weeks. Anyway, that's all from me. Thank you so much for watching. If you want to get more from me, you can pick up a copy of my book. It's called Thriving Beyond 50, and you can find it on Amazon using the link below. Anyway, thank you for watching, and I'll see you on the next video.